Now students, in today's lecture, we are going to study an other indirectly acting cholinergic drug and other agent that has ability to inhibit the enzyme acetylcholine esterase, that is neostigmine. So, neostigmine is basically a synthetic compound. It is a carbamic acid ester. It reversibly inhibits the enzyme acetylcholine esterase. As we already know, acetylcholine esterase is abbreviated as ACAG. So, it acts in a similar way like the physostigmine, which we have discussed in our previous lecture. Now, what are the actions of neostigmine? Neostigmine is a quaternary nitrogen. It cannot cross the CNS. It cannot enter in the CNS. It cannot cross the blood-brain barrier. So this is more polar drug as compared to physostigmine and is absorbed poorly from the GIT tract. Secondly, it has effects on skeletal muscles, and these effects on skeletal muscles are greater than that of the physostigmine. So it can stimulate the contraction before it paralyzes the skeletal muscles. Thirdly, this drug has intermediate duration of action, that is from 30 minutes to 2 hours. Now, what are the therapeutic uses of the drug? It is used to stimulate the bladder and the GIT tract. It is an antidote for the competitive neuromuscular blocking agents. This drug is also used to manage the symptoms of myasthenia gravis. Now, what are the adverse effects? It may cause the effects which are associated with the overdose of the acetylcholine, like starvation, flushing, decrease in blood pressure, nausea, abdominal pain, diarrhea, and bronchospasm. So, as we have discussed, that neostigmine is a quaternary structure amine. So, it doesn't cross the blood-brain barrier. It cannot enter in the CNS and is thus not useful to overcome the toxicity of the central acting antimuscarinic agents like atropine. The drug is contraindicated in intestinal and urinary bladder obstruction. Why this is contraindicated in these obstructions? Because we know that it increases the contraction of smooth muscles. So this drug has ability to potentiate to stimulate the inflammation, that is peritonitis, by increasing the GI motility. So this was all about the drug neostigmine. This was all about its action, adverse effects, and contraindications.